Hello, my name is Caitlin Burnside. I am a public health nurse with Peterborough Public Health, and I am here to talk about health and safety for childcare settings during COVID-19. I have provided my direct contact information in the slides. If you have any general questions about the presentation, you can always contact myself. If you have questions specific to your facility, please contact your public health inspector. Thank you to Ryan, Ravi, Brian, Claire, and Keith for helping me out with the presentation. This presentation is current as of June 23rd, 2020. Operators must be aware of changes that may occur as part of their response to COVID-19. And this presentation is intended to provide education and is not legal guidance. The intended audience is operators within the city and county of Peterborough, Hiawatha, and Curve Lake First Nations. All other regions must consult with the applicable health unit. In this presentation, I will review current COVID orders, public health measures in childcare settings, and review some additional helpful resources that you can refer to as you begin to reopen. So on June 9th, 2020, the Ontario government advised that childcare centres and home care providers would be able to open, and emergency childcare centres would begin to wind down on June 26, 2020. With this announcement, the Ministry of Education released a guidance document, and this guidance document is intended to support childcare partners and is to be used to meet requirements in conjunction with the Childcare and Early Years Act. This guidance document contains thorough information for operators planning to open their home or center-based daycares, and is a helpful tool as you build your policies and procedures. Current emergency orders affecting daycares include the closure of community outdoor playgrounds, play structures, and equipment. This emergency order is in effect until June 30th unless extended. So what is COVID? Although I'm sure we're all familiar with it now, it is a disease caused by the 2019 novel coronavirus. In humans, coronaviruses can cause illness ranging from common cold to much more severe respiratory infections. It's estimated that approximately 80% of people infected with COVID-19 will have mild to moderate respiratory symptoms. These mild to moderate infections are part of the reason why COVID is so contagious. Just to note that people over 70 years of age and immunocompromised individuals are at the highest risk for developing a more severe illness that can be life-threatening. So how is COVID spread? COVID is spread from person to person through respiratory droplets. Respiratory droplets are expelled through the nose and mouth. So when a person comes into contact with these droplets, whether it's directly or indirectly from a contaminated surface, and then touch their mouth, nose, or eyes, they can become infected. This is why it's important to maintain a distance of at least 2 meters between individuals when possible, especially if they're exhibiting symptoms. During the early months of COVID, some news outlets were reporting that COVID-19 can live in the air for 3 hours. This information was based on a single study, so aerosols containing SARS-CoV-2 or SARS-CoV-1 were generated with the use of a 3-jet collision nebulizer and fed into a Goldberg drum to create an aerosolized environment. This does not reflect normal human cough conditions or normal environmental air conditions. Updated information recommends droplet contact precautions when providing care. So airborne precautions would be used when an aerosol generating medical procedure is anticipated. This situation would not happen in a daycare, Public Health Ontario has advised that there is no evidence that COVID-19 is transmitted through the airborne route. And last, data from the World Health Organization indicates that COVID-19 is primarily transmitted from symptomatic people to others who are in close or direct contact through respiratory droplets or by contact with contaminated objects and surfaces. We can protect ourselves and others from COVID-19 with physical distancing, meticulous hand hygiene, and reducing the amount of times we touch our face. Physical distancing means reducing close contact with others by maintaining a distance of at least 2 meters. When hands are visibly soiled or sticky, hand hygiene should be conducted. Use liquid hand soap and warm running water. Lather hands covering all surfaces for at least 20 seconds, including between the fingers, the tips of the fingers, and the backs of hands. These are commonly missed areas. Rinse with warm water and dry your hands with a paper towel or a hand dryer. Encourage staff and children to perform regular hand hygiene. If hands are not visibly soiled or feeling dirty, hand sanitizer can be used as a method of hand hygiene. Cover all surfaces of hands with sanitizer and rub for approximately 20 seconds or until they're dry, and ensure to get those tricky areas that we discussed. Hand sanitizer with a alcohol content of at least 60% should be used. Additionally, Health Canada does have a list of approved hand sanitizers effective against COVID-19 listed on their website. This website also lists cleaning and disinfectant agents that can be used. For respiratory etiquette, cover your cough, use tissue, and wash your hands after. If tissue is not available, cough or sneeze into your elbow and make sure to wash your hands. Try not to be around anybody if you are sick, especially at a daycare. And lastly, limit hand-to-face contact. There are 5 main principles known as routine practices to prevent and control transmission of microorganisms. We will focus on how these principles can be used to prevent and control transmission of COVID-19, but these principles can also be used to reduce the spread of common infections typically seen in a daycare setting. Risk assessment should be conducted before each interaction between you and a child or you and another staff member at the daycare. Use the knowledge of how COVID-19 is spread to determine the risk in the interaction. These are some examples of questions you can ask yourself to assess the risk. What will you be doing? Is there risk of exposure to COVID-19? Does the child or staff member have symptoms of a respiratory infection, etc.? Hand hygiene is one of the most important actions you can take against COVID-19. If your hands or a child's hands become contaminated, good hand hygiene will reduce the risk of infection. Hand hygiene should be promoted for both staff and children. There are several moments hand hygiene should be conducted, and this slide highlights many of those moments. So before touching your face, before any food handling, after using the washroom, of course, after contact with body substances, mucous membranes of the eyes, nose, mouth, or non-intact skin. Anytime before and after client contact, and after touching regularly touched items such as doorknobs, toilets, and sinks. Basically, whenever there is a chance that your hands may have become contaminated. Personal protective equipment, or PPE, can be used when there is a high risk of coming into contact with somebody who may have COVID-19. Properly putting on PPE and taking off PPE. This is called donning and doffing of PPE. Improper use of PPE can create a false sense of confidence and can increase the risk of transmission. Child care providers would need to wear PPE if they are caring for a child that develops symptoms of COVID-19 at the daycare. PPE use should be based on your initial risk assessment as well. Surgical or procedural masks should be worn by those who are ill. Children should only wear surgical or procedural masks if they are above the age of 2 and are able to tolerate it. Wearing a non-medical mask, such as a cotton mask, does not protect the person who is wearing the mask, but rather protects others from the person wearing the mask because it can catch the respiratory droplets. Strict hand hygiene and public health measures, including frequent hand washing, physical distancing, will all reduce your chance of being exposed to the virus. Non-medical masks are an additional measure you can take when physical distancing isn't possible, but make sure to follow your daycare's policy around the use of these types of masks. Eye protection should be worn if caring for a symptomatic child and should always be washed and disinfected after each use. Gloves should be worn if coming into contact with contaminated surfaces. Ensure to perform hand hygiene before and after using gloves. Donning and doffing, or putting on and taking off PPE, is the next important step to protecting yourself. Public Health Ontario has posters and videos available on its website to review donning and doffing. You can see I included a picture on the right there of one of their posters. However, just make sure to exclude steps that would not apply to you in your daycare setting, such as wearing a gown. Perform hand hygiene before putting on and before taking off eye protection in your surgical mask. The next principle would be controlling the environment. So this is what you can do to control or limit exposure in the environment. Screening will be required in all facilities as per the operational guide. Ensure that anyone with symptoms does not enter the building or go past the screening area, and maintain cohorts as laid out in the operational guidelines. Keep surfaces clean and disinfected. I will review some details around screening. There will be a screening tool available on the Peterborough Public Health website. Screening should be conducted for anyone entering the building, including children, staff, parents, and essential visitors. And I have included a link to the Ministry of Health website, which has a reference document for symptoms. So examples of symptoms include fever, cough, shortness of breath. Those 3 symptoms are very common. However, in different populations, particularly in children, sometimes COVID-19 presents with atypical symptoms such as nausea, vomiting, diarrhea, and abdominal pain, unexplained tiredness, loss of taste and/or smell. Make sure to review the ministry list of symptoms regularly, because they can become updated as more information becomes available. If an individual has symptoms or advises they have had close contact with a case or with somebody who is sick, ensure they are referred to the Government of Ontario assessment tool and advise to contact one of the local assessment centers for testing if required. If it is determined that symptoms are not related to COVID-19, advise the person not to return to the facility until 24 hours after their symptoms resolve or as per the daycare's policy. Staff or providers that develop symptoms should isolate immediately and wear a mask and leave the premises. If a child develops symptoms while at the daycare, ensure to isolate them in a separate room or at least maintain 2 meters from others around them. If tolerated and above the age of 2, the symptomatic child should wear a mask. Contact the parent or guardian immediately for pickup. Providers caring for symptomatic children should don appropriate PPE, and the sick person should be advised to arrange for testing by contacting the assessment center. Environmental cleaning and disinfection is a critical step as part of the environmental control principles. So items that are easy to clean and disinfect should be used. And items should be cleaned and disinfected between each use and between each child. Again, Health Canada maintains a list of disinfectants that are proved to be effective against COVID-19. You can refer to their website and it is updated frequently. Items should be made out of a material that allows them to be easily cleaned, and try and limit the sharing of items. And ensure that you're disinfecting commonly touched surfaces such as toys, learning materials, baskets and containers, posters on walls, that kind of thing. Here is a list of toys and items that are not easily cleaned. So soft or plush toys, items requiring laundering such as dress-up clothes, paper materials shared between children such as books, puzzles, cards, and games, and sensory play, including the use of water, sand, and dry foods. Personal items such as tablets and books should not be shared with others and should be kept in a safe, clean location. Enhanced cleaning of commonly touched surfaces should be completed at least twice a day. Maintaining a log of cleaning and disinfection is important, so clean items that are touched by different individuals between each use, such as toilets, sleeping mats, and cribs. And in regards to sleeping arrangements, a minimum of 2 meters should be maintained between children who are napping, and children should be arranged head to toe. The operational guide encourages daycare providers to have children spend time outdoors. The same cleaning and disinfection recommendations apply to toys and equipment used outside. Play structures at the childcare facility should only be used by one cohort at a time. If multiple cohorts are sharing outdoor space, ensure that there is at least 2 meters between the 2 cohorts. Moving on to administrative controls. It is important that you review your facility's policies to make sure you don't miss any changes. Do not come to the facility if you are sick. Use posters to encourage hand hygiene for both staff and children, and document records as required by your facility. To recap, COVID-19 is spread through direct or indirect contact with respiratory droplets, and there are ways we can protect ourselves. There are many resources you can review to help ensure a safe reopening. In this slide, I have included a list of those resources. So of course, your Child Care Center's policies, the Ministry of Education's operational guidance document, the Ontario Ministry of Health's website often has updated documents on COVID-19. For daycares in particular, the reference document for symptoms will be helpful to review frequently. Public Health Ontario has many resources on COVID-19, donning and doffing PPE, and many posters and videos you can follow. And it's important to stay up to date on information through these resources. If you have any questions, please contact your public health unit. If you have specific questions related to your facility, contact your public health inspector. Thank you.